Welcome back to Lab Talk, the podcast where we break down the science behind clinical diagnostics and explore how laboratory testing shapes patient care. Today, we're diving into a fascinating hematology parameter that's gaining more attention in modern diagnostics: immature granulocytes, or IG. These early stage white blood cells may provide helpful insights into infections, inflammation, and bone marrow disorders. So, if you've ever wondered what it means when you see an elevated IG count on a lab report, or why some analyzers can detect them automatically, stick around. This episode is packed with everything you need to know about immature granulocytes and why they matter in clinical practice. Let's get started. All right, let's start with the basics. What are immature granulocytes, or IG? Granulocytes are a type of white blood cell, WBC for short, that play a major role in our immune system. They include neutrophils, which are the first line of defense against bacterial infections; eosinophils, which are key players in allergic responses and parasitic infections; and basophils, which are involved in inflammatory reactions. These cells normally develop in the bone marrow through a process called granulopoiesis, before being released into circulation when fully mature. However, when the bone marrow is under stress, whether due to infection, inflammation, or bone marrow disorders, it may release immature granulocytes into the bloodstream prematurely. These immature forms include promyelocytes, myelocytes, and metamyelocytes. Under normal conditions, we don't see many of these in peripheral blood, so when IGs do appear, it may signal an underlying condition that needs further investigation. So, why should laboratories adopt automated IG measurement? Here are some key advantages. 1. Automated analysis, which eliminates the need for labor-intensive manual microscopy. 2. High sensitivity. It detects low levels of IG that may be overlooked in manual counts. 3. Standardization. It ensures consistent, objective results across different operators and laboratories. 4. Operational efficiency. Automated IG% and absolute counts may improve lab efficiency by reducing manual reviews. And Sysmex analyzers include IGs in the automated differential without the need for special reagents or sample preparation. Now, let's consider who may benefit from IG testing. 1. Infectious disease specialists, critical care, and emergency medicine. Elevated IGs are an indication of left shift, which is associated with infection, inflammation, or other bone marrow conditions. 2. Hematologists and oncologists. IG monitoring may aid in short and long-term management of patients with bone marrow disorders. 3. The autoimmune disease management team. IG trending over time may assist with treating chronic inflammatory conditions. By incorporating automated IG measurements into routine hematology testing, results are standardized and may provide clinicians with additional data to manage patients. All right, let's wrap this up with a quick recap. IG includes promyelocytes, myelocytes, and metamyelocytes, which are early granulocyte precursors. IGs are normally absent in peripheral blood, but their presence indicates a left shift which may be associated with infection, inflammation, or bone marrow disorders. Sysmex analyzers use fluorescence flow cytometry to provide automated, highly sensitive, and standardized IG measurement with every automated differential. Automated IG% and absolute counts can improve lab efficiency by reducing manual reviews. That's it for today's episode of Lab Talk. If you found this breakdown of immature granulocyte helpful, be sure to subscribe, leave a review, and share it with your fellow lab professionals. Got a question or a topic suggestion? Drop me a message, and let's keep the conversation going. Until next time, keep learning, keep questioning, and keep making a difference in the lab.